data showing there was moderate significance between the group for both left and right foot. In the study where the study duration was not enough to prove an effective change in the mid-large structure. So, but it in the meantime, it showed that it always it had a tendency to reduce the soft tissue plantar pressure across the foot, as well as improving the foot pain in the subjects. So this is the comparison of pre and post data between the intervention and control group. So this is where the first row indicates the numerical pain rating scale, and the next two rows indicates navicular drop test, and the next two where the arch index between the groups was compared, and there was not very less significance, where the plantar pressure data showed in the next two rows 6 and 7 showed much significance. So this is where the limitations of the study comes in, where the study was not a true placebo, the control group was not a true placebo, and they were not efficient in proving that the height of the longitudinal arch and the plantar pressure and pain improved statistically, but it had efficiency in reducing the soft tissue strain and plantar pressure. And the study concluded that there is moderate significance in the pain and overall surface pressures, arch index values, and navicular drop test as the patient used it for more than 5 days, 5 hours per day. And if the intervention time was more, then it could have shown a better result of the study. So these are my references. Thank you.
Thank you, Mr. Karthik, for your informative presentation. Anyone having any question, please feel free to ask. Any question?
Are there any questions?
Audience are free to ask the questions, online and on-site.
Good morning, all of you. The intervention group, the treatment was all for the same, like insoles.
Could you rephrase that question?
The intervention group, have you done the same treatment for all mild and moderate groups for pus planus, like giving the insoles itself?
It was different based on the condition of the patient. So if it was moderate, if the condition of the person differs, then the custom made insoles also differ. So if the patient has, if the subject has a hindfoot problem and a midfoot problem in one condition, the other person might have a forefoot and a hindfoot issue. So that was addressed separately based on the patient condition.
So, and you are given the correction in insole.
Yeah,
itself.
based on the user.
Thank you. Anyone?
We have online participant. I request Mr. Satyavan Mishra to ask the question. Sir, you can ask the question if you have any.
I am audible.
Yes, sir, you are audible.
Nice presentation. My two questions are there. What are the rate? What are the process for the navicular drop test? And another one is what are the parameters for the NPRS value?
So we will take your question one by one. I request Karthik.
Good morning, sir.
Yeah.
So if I may rephrase your question, the first question was, what are the causes of navicular drop?
Yes.
I assume. So the causes for navicular drop in my studies, which I've seen, is that if there is a hypomobile foot, or if there is dysfunction in the ligaments and the ligaments and tissues in the medial compartment of the midfoot, then it is a very big cause for navicular drop. So in case of, especially in case of flexible pes planus, this is a very common seen condition, and it is assessed using navicular drop test.
Okay. And what way, how you will define that this is the navicular drop test? Because the structural changes are seen in the diabetes foot cares, whatever the Dr. Sanjay has told in his earlier speech, and we are all agree that diabetic foot care is a very sensitive one, and we have to accordingly plan it. Means what will be the process? You are explaining it very well. Means how will you identify that this is the need that we have to do this test only?
Yes, sir.
I think my question is clear.
Yes,
and you
your
can,
question is clear, sir. So the problem with flexible flat feet in this condition is that there is structural changes in the foot. So it is a
Yes.
flexible condition which can be corrected using foot orthosis. So before it becomes from a flexible condition to a condition where it is compensated by other problems, and later it comes to a fixed irreversible problem. Before that, we'll be correcting the flexible pes planus. So mainly in diabetes, the issue comes is that while it starts with a pes planus, it can go into a fixed Charcot foot condition in the later stages. So this may be due to uneven distribution of weight along the surface of the foot. So this can be addressed in the early stages using a custom-made insole.
okay, thank you.
Thank you so much, sir. Was there a second question?
Anyone having any question, please free to ask.
No, my second question was what are the parameters of NPRS values?
So the dimensions of the numerical pain rating scale is a scale from 1 to 10, where you it is similar to the VAS scale. So it is also a reliable method to find out the pain in the for a regional condition. So between the scale, we ask the user from starting with very less pain and ending with a pain which the person cannot tolerate at all. So we calculate according to that, and we ask the user before the intervention is given and after the intervention is given, how the status of the pain is.
Thank you. Thank you.
Thank you, sir. Thank you.
Fine.
Yes, sir.
So, sorry if you already mentioned that, but I will ask it. Sorry if you mentioned that already, but maybe I did not hear. We had different cases, okay, and you addressed them.
Yes.
So I have a question. Sometimes the flat foot is not primary, it's sometimes secondary. So the question is, did you address the primary cause if it is secondary? And what happened if you did so? Thank you.
Thank you for your question, Abdullah. I'd like to answer that question by going back to the inclusion criteria, where I selected the individuals where the primary cause was any kind of dysfunction in the foot as whole. So if there was any kind of secondary condition, like if there is genu valgum, yeah, or hallux valgus too. Hallux valgus is a condition where it can elongate the arch. It can elongate the arch. So those conditions were eliminated, where the primary condition was mainly the midfoot and rear foot condition. So if there was mild forefoot condition, mild hallux was there, then it could be assessed with the insole, but it was not a primary condition for the dysfunction of the foot. Yeah, there might be conditions like function hallux limitus, which is very severe in some cases, which cannot be addressed with foot orthosis alone. So that should be considered before giving the treatment.
I hope you got your answer, Abdullah. Thank you for asking question. Thank you, Karthik.
Thank you, ma'am.
The next presentation of the today's CRE is the effective of customized foot insole and texture insole on the balance and postural control in elderly people and fall prevention. It is a randomized controlled clinical trial. The author of this topic is Mr. Sharma Raju, who is the Assistant Professor of Mobility India, and Ms. Minakshi, who is the Assistant Professor of Mobility India. The presenter of this topic is Mr. Lokesh Sharma, who is the RCI certified P&O. Please welcome to the Mr. Lokesh Sharma.
Hello. Good morning, one and all who are present here. It's honored to be a part of CRE presenter. I would thank Mobility India to giving this opportunity in this huge forum. And thank you for my authors, Ms. Minakshi, Assistant Professor, P&O, and my co-guide, Mr. Samaraju, who is a physiotherapy assistant professor. And my topic is the effectiveness of customized foot insole and textured insole on the balance and posture control in elderly population. So it is a randomized controlled clinical trial. So falls are prominent among the external causes of unintentional injuries. Falls and unstable balance, high risk and serious clinical problems faced by the older adults. So there are a cause of substantial rates of mortality and morbidity, as well as major contributors to immobility and premature nursing placements. So the incidence of falls and injuries increase with age. Therefore, human aging causes physiological changes such as decreased postural balance, the increase the risk of falls, age-related changes in peripheral and central components of visual, somatosensory, and vestibular system can be expected to affect balance and mobility. So falls and imbalance in the elderly, which cause to major hospitalization and nursing home placement. So for this, insoles are simple intervention that can be low cost advanced intervention to improve balance in elderly. So the objective of my study is to compare and find the effectiveness of two insoles, which is customized insole and textured insole on balance and postural control in elderly. And the secondary objective is to find the risk of fall prevention in elderly by using customized insole and textured insole. So the methods which are used in my studies, the study design is randomized controlled clinical trial with patient preferred study, and the study subjects were community dwelling elders who are independent and without using any assistive device or orthosis. Age is equal or more than 60 years age, and the sample size is 30. The study setting is Mobility India Rehabilitation Research Center and few old age homes near Bangalore. So the inclusion criteria of my study is age above 60, community dwelling elderlies, those who had 2 or more than 2 falls in previous year, foot pain, and the exclusion criteria is previous history of surgery, foot ulcers, lower limb fractures, neurological conditions like stroke, Parkinson's, and multiple sclerosis. So this is the model of the textured insole, the blue one, and the customized insole is the yellow one. So this is the positive mold, and the after the fabrication, the model of the 2 insoles. So the methods of data collection were a total of 30 elderlies, about 60 were included with the assessment of this I'll be showing in the flow chart. It will be easy. So the subjects with the balance and postural control and fall history, those who included in the study has been those who fulfill the inclusion criteria will be included, and those who are not fulfilling the inclusion, they will be excluded. So among the 30, by randomization, it was a 2-3 group study. So group 1 will be customized insole, group 2 textured insole, group 3 without insoles. So after the insoles have been given, pre-test has been done, and 8 weeks follow-up period. Then post-test has been done, and with the post-test results, comparison was done, and the results has been taken. So the outcome measures used in the study is work balance scale, time up and go test, VAS scale, fall efficiency scale. And for the data interpretation, SPSS software was used for the analysis. It was a one-way ANOVA test carried out for the data analysis and interpretation. So the results are, there was a significant difference, moderate in both work balance and time of go test in the post data. So there was a strongly significant difference in the time of go test post data. So that I mentioned here. So in discussion, previously, there are studies with the customized insole and vibration insoles. So insoles with the texture surface, concerning insoles with vibration stimuli. Studies are promising with some evidence of balance improvement in elderly people and subjects with pathology such as stroke, diabetes, and ankle instability. So in this study, both insoles have improved sensory output, favoring a better in balance postural control. There is a significant difference found in the tug post test, and also a few has been interviewed regarding the insole feedback after the study. So the conclusion is, in this randomized controlled clinical trial, we observed improvements in the balance and posture control of the subject wearing customized or textured insole. So these interventions may represent a low cost and high availability advanced method to improve balance and community dwelling elderly people. So prospective studies in this field should be encouraged to confirm its benefits over long period, especially with regards to fall prevention. So the key summary is the findings of this study have significant implications for foot insole research. The use of insoles for 8 weeks result in statistical significant improvements in the balance, functional mobility, and pain. So there is no similar study in this literature. There is a clear need of further studies that would determine the long-term benefits and effects of insole in the older population. This study focused on healthy and independent older adult population. Research is also needed to be more diverse older population. So further studies is also needed in the use of insoles in improve balance, reduce pain, and decrease the risk of falls in older adults. These are my references. Thank you.
Thank you, Lokesh Sharma, for the informative presentation. Anyone having any question? Please free to ask. Any question?
First of all, like a very good presentation by Lokesh. And I want to ask, like, which randomization technique you used for your study? Like you told, this is randomization study. So which randomization technique you used?
Thank you, Ravi, for asking the question. This is a randomized control clinical trial where a randomized control trial has one control group and one intervention group. Here I have used 2 intervention group and 1 control group. And the study is mentioned as patient preferred study. So it's a partial randomized control trial with patient preference study. As patient can suggest or can select the interventions favoring to their treatment. That is.
Thank you. Is there any question? Thank you, everyone. Thank you, Lokesh.
Thank you.
Thank you, Ms. Sudipta and Lokesh. Now we will have a short break, and after break we will start with the panel discussion. And for that, I request Mr. Jibanjit Mohanty to take the initiative. Thank you. Thank you so much. We will have a short break of 15 minutes.
खत्म